I've got backup to the backup.
Good morning to all of you. I can't see you because of the lights, but having walked through there, I know you are there. I am John Ribble. I'm the Dean of the University of Texas Medical School at Houston, and I welcome you to our 20th graduation ceremony. I have the pleasant task of introducing to you the members of the stage party. Dr. Richard Seltzer, our commencement speaker. Seated next is Dr. M. David Lowe, President of the University of Texas Houston Health Science Center. Next is Dr. Joseph Painter, President-elect of the American Medical Association. Seated next is Dr. Charles W. Bailey, President of the Harris County Medical Society. Next, Dr. Thomas F. Burks, Executive Vice President for Research and Academic Affairs of the University of Texas Houston Health Science Center. Dr. Susan E. Nelson, Class of 1984, President of the Alumni Association of the Medical School. Mr. Jeffrey Paul Bishop, President of the Graduating Class of 1993. On the second row is Dr. Albert Gunn, Associate Dean for Admissions at the Medical School, Dr. Ronald C. Merrill, Vice Dean of the school, Dr. Margaret McNeese, Associate Dean for Student Affairs at the Medical School, Dr. Patricia M. Butler, Associate Dean for Educational Programs. There is in flowing robes, trimmed in bright colors. There has been a parade of sorts, and soon these brand new physicians will profess a formula that has been handed down from doctor to doctor for more than 2,000 years. Sanitized and modernized to remove swearing by Apollo and certain other passages that indicate its origin in ancient Greece, the Hippocratic Oath contains an outline of appropriate conduct for a physician. However, reciting it here is more meaningful as a symbol of the continuity of the medical profession and its altruism than for any words which it contains. Ceremony can provide a way to dramatize excitement, anticipation, rejoicing, and relief, as well as sadness and anxiety. For those who graduate, one important part of life is over. Some friendships will end. Youth is slipping away and can't be recaptured. The future, though promising, is still unknown. But mainly, this is a day to recognize these new doctors. I hope you will use today's commencement exercises to celebrate this important milestone. Applaud the successful achievements of the graduates. Take satisfaction in your role in forming their lives and preparing them for this moment. Send them on their way with great expectations of continued growth and expanded service. I welcome you to this 20th graduation ceremony of the University of Texas Medical School. I invite you to join with all of us at the school in celebrating this event. At this time, I would like to call on our president, David Lowe.
Dr. Selzer, honored guests, distinguished faculty, family, friends, most especially the graduating class of 1993. It gives me great pleasure, tremendous pleasure, to welcome each of you to this commencement exercise and to share with all of the other people on the stage this last opportunity to give you some advice that maybe we forgot to give you over the last 4 years. It's a tradition, so bear with us. It won't last too long. And we feel we have to do it. It's our duty. In looking for a theme for my little greetings this morning, I reread some of the things that the Board of Internal Medicine says are attributes of the best kind of physician. And I thought I'd like to share those with you this morning with a little bit of a twist, with a David Lowe addendum, if you like. The Board of Internal Medicine says, of course, that one needs to be competent, one has to have the technical skills, the knowledge of medical science, one must have practiced and acquired ability to manage, to diagnose disease and to manage it. All of those things are critical, and you would not be here this morning if the faculty of this school did not believe you could do all of those things. They also say that it is very important that throughout your career you cultivate those things certainly in a continual way, but also that you should cultivate other attributes that really will make you the very best kind of doctor. Those attributes that they suggest you should cultivate in addition to your technical and scientific and medical abilities are the attributes of integrity, respect, and compassion. And I'm going to add a fourth, the attribute of community responsibility. When the Board of Internal Medicine talks about integrity in this way, they mean the personal commitment to be honest in everything, honest and trustworthy to yourself and to your patients in evaluating and in demonstrating your abilities and your skills. Don't pretend ever to be something you are not. Respect, of course, in their view, is the personal commitment to honor others' choices and their rights regarding themselves and their medical care. I would add one thing to that description of respect, and that is that you should work very hard to bring the patient into the decisions about his or her care, because the patient, you will discover, can be very wise when given your attention, when given your efforts to educate him or her about the problems that you will face together. The board talks about compassion, and you have heard much about it. You are all compassionate people. You know, of course, that medicine is part science and part art, and the art of medicine is really the art of allowing your individuality to interact with that of the patient. And they describe compassion as an appreciation that suffering and illness do engender special needs for comfort and health, and you should be ready to give those. And I know you can, and I know you will. I have added the attribute of community responsibility to this list of the Board of Internal Medicine because I believe, especially at this time in the history of our country, that kind of attribute is required of all of us. What do I mean by community responsibility in this context? Very simply that you as a professional are given enormous privilege. You are given a tremendous amount of knowledge that very few people have an opportunity to gain or to practice. You are given a status in society that is unique in spite of what you may hear or read in the media. That status will always remain very high and very, very important. You will be listened to. What I mean by community responsibility is that you should, when possible, speak out, work to deal with those things in the community that do foster illness and disease and unhappiness and suffering. Do what you can to get rid of them. It does little good to take the bullets out of the bodies of your patients and do nothing about the guns in the hands of irresponsible people. It does little good for society to leach the lead out of the body of a sick child and leave it on the walls of the apartment to which that child will return after you care for it. It does little good to keep infants, premature infants, alive and to send that infant back to an environment of crack cocaine addiction, economic deprivation, and social irresponsibility. You should speak out, and you can, and I know that you will. If you do cultivate all of those attributes, you will be successful beyond your dreams, and I wish you in your careers Godspeed and good luck.
Administrative costs, and not for other factors that are extraneous to the direct care of the patient. That's AMA's message in Washington. We don't know what will be forthcoming, but now, as you enter your training, let me leave you with two thoughts. Keep your focus on the patient. Apply that ethical principle of putting the patient first, above all else, as the beacon that guides your decision. That principle is what makes medicine a profession and separates us from a trade. Secondly, when you're with a patient, remember to add that personal touch to your clinical skill. Give the patient that personalized care and attention that is so vital to speeding anyone's recovery when they're ill or injured. By doing so, you'll capture the essence of medicine. The patient-physician trust that is the cornerstone of good medical care and the base upon which then you can apply the latest technology and give them the best care in the world. Whatever lies ahead in our healthcare system, you are entering a profession that is demanding, challenging, exciting, and rewarding. Would I do it again? Yes, without question. And with the scientific advances that you have on the horizon, you will have more and better tools to prevent and relieve suffering than those who have gone before you. That, after all, is what medicine is all about. Good luck, Godspeed, and thank you.
This is the 26th year since my graduation, and when I see this group, it seems like yesterday. It's a very, very special occasion for you, after 4 years of hard work and study, to be at this point in your lives. And it's equally very special to me to have been invited and to be honored and privileged to be.
It has helped us in the medical school as we're listening to people about what primary care is and what it ought to be. And I'm very pleased that Susan's here today to bring you greetings. Susan.
It is my distinct privilege to be a part of this great day in your lives. Somehow it is unbelievable to me that I was in your position just 9 years ago. A lot has happened in the practice of medicine in that short period of time. As you join our ranks today, we must all remember that we have one thing in common, a degree in medicine. Our guiding principles must continue to be quality patient care. After all, that is why we went to medical school and why we endured the long hours of training and self-sacrifice. The University of Texas Medical School Alumni Association would like to welcome you as our newest members. We commend your achievements, we applaud your triumphs, and we encourage your involvement. Congratulations.
I would like to welcome you to the 20th commencement exercises of the University of Texas Medical School at Houston. You are all here today at our invitation to celebrate this time with us because we feel indebted to you. Right now, we would like to recognize some very special people who are here.
Treat that is in store for you. The first is on opening the abdominal cavity. Such a primitive place. One expects to find drawings of buffalo on the walls. The sense of trespassing is heightened by the world's light illuminating the organs. Their secret colors revealed, maroon and salmon and yellow. An arc of the liver shines high on the right like a dark sun. It laps over the pink sweep of the stomach, from whose lower border the gauzy omentum is draped, and through which veil one sees sinuous, slow as just fed snakes, the indolent coils of the intestine. And on doctors and patients. When performing an examination, the doctor may glance up to see the trust that glows deep within the eyes of the patient. Sparks of it will leap forth to ignite him, for it is trust, not gratitude or worship, that animates the physician. Add to this the possibility of the grace of healing, and there is no human contact more beautiful. I present to you Dr.
Dean Ribble, Dr. Lowe, distinguished colleagues on the platform, distinguished faculty, ladies and gentlemen, and especially members of the class of 1993. It is a great privilege for me to help welcome you into the noblest profession of them all. As you have heard, I am that surgeon who writes. Actually, writing and surgery are really quite similar. In each, the instrument that is used is about the same size. When you use a scalpel, blood is shed. When you use a pen, ink is spilled upon a page. Now, instead of suturing the tissues of the body together, I suture words into sentences, sentences into paragraphs. And a story is rather like an operation. It has a beginning, a middle, and an end. You make the incision, rummage around a little bit inside, and stitch it up. It is daily present. Some choose out of a fascination with the body, how it is made, how it functions. One cannot help but be in awe of such a creation. And to remember the words of the poet Marianne Moore, who, when looking at a cherry, wrote, "What sap went through that tiny thread to make the cherry red?" It's that kind of awe that we feel. Many are the doctors whose ambition was sparked by an illness or injury sustained early in life. Still others out of an attraction for disease, pathology, the dark side of the body. There is about the unbeautiful facts of wounds something that exhilarates, even as it appalls. I chose to become a doctor at age 12, when my general practitioner father died, long before my eyes had had their fill of him. If I could no longer find him in the flesh, I would find my father through the work that he had done. It was a wise decision for a grief-stricken boy. For in the years to come, I grew to know my father more intimately than had we lived together for decades. During the Great Depression in Troy, New York, we lived on the second floor of the house just above Father's office. And from my earliest days, I sat on the landing and listened to the moans and cries that floated up the staircase. No words, only the howled vowels of pain, inarticulate sounds of weeping that rose above the steady rumble of Father's voice. At night, after evening office hours, my brother Billy and I would sneak down to his darkened consultation room, and there, by the shamefaced light of a candle stub, we would open the medical textbooks and look at the pictures Our favorite was the textbook of obstetrics and gynecology. Once, attempting to coax me out of a mood, Father drew me between his knees, then gently fit the earpieces of his stethoscope into my ears. He placed the disc over his own heart. All at once, there was the distant, muffled thudding of life itself. "Loved up," he said, "loved up." I listened and was touched. Just so is the hound blooded to the hunt at its master's knee. It was a year later, on a house call, that he again offered me the stethoscope. "Would you mind?" he asked the elderly man sitting propped in the bed. "Well, well," said the man, beaming. "Another doctor, is it? Going to follow in your daddy's footsteps?" I went to place the disc on his chest. "Wait," said Father. "Warm it with your breath, the way I do." I huffed at the disc. "All right now," said Father. And for the first time, I placed my hand upon a fellow human being in the diagnostic act. And I heard the wild, irregular beat of auricular fibrillation that has no logical sequence. It was in one of those parlors on a house call that I first witnessed death. The door to the sick room had not stayed shut, and through the crack I could see the bed and its contents. Father leaned over the man who labored there. A rosary had been entwined in his fingers, which fumbled with a bit of the blanket. There was his pointed nose, the blue toes which had escaped from the covers. Rapt, I watched the way he chased his breath until he caught up with it, but only for a moment before it once again broke free and was running away with quick, small steps. Exhausted, the man lay as if deciding whether to mount another chase. Then all at once his ribs started up from the bed and off he went once more, pumping after his wayward breath. It's called Cheyne-Stokes breathing, Father told me afterwards. When they start that, you know it won't be long. Why does everybody have to die? I wanted to know. It isn't fair. Oh, it is too fair. It's part of being a person. It would be much worse not to. Mother was a singer, the owner of a small lyric soprano that sounded as though a white mouse were ringing a tiny silver bell. She was also the doctor's wife, a position of no small importance in those days. People thought she knew more than she did. And not a day went by but she was stopped on the street and asked for medical advice, which she labeled out as though it were bounty. "You cannot possibly be having nervous prostration," she told one woman. "That is a disease of the male gland." I prostrate upon the ground, even for those of us who have one. So far as I know, such quibbling never caused her a moment's hesitation. Those were simpler times, in fact. Today, of course, all the facts of in vitro fertilization are in the newspaper for children in the 5th grade to read. I remember once asking her the difference between a bull and an ox. A bull, she explained, is the father, and the ox is the uncle. A young woman, her mouth twisted from the surgical division of her facial nerve. Well, I had dissected its course with religious fervor. It was at last necessary to sacrifice the nerve in order to remove the tumor. Some days later, when I visited her on rounds, her young husband was there. "Will my mouth always be this way?" she asked. I nodded and explained about the need for it. She fell silent. The young man smiled. "I like it," he said. "It's kind of cute." And unmindful of me, he bent to kiss her crooked mouth, and I so close I could see how he twisted his own lips to fit hers, to show her that their kiss still worked. And then I knew who he was. In ancient Greece, the gods sometimes appeared as mortals. I lowered my gaze and held my breath. One is not bold in an encounter with a god. It is 7 years since I walked away from my beloved workbench in the operating room. And so complete has been my separation from medicine as to make it seem that I had died and been reborn into another incarnation, only with the singular knowledge of what I had been in my previous existence, a doctor. Now and then, it happens that I'm brought back with startling clarity to that past life. Listen, I spend the better part of each day at the Yale Library where I write and read. Toward evening, I take the shuttle bus home. One recent day, I boarded the bus and took a seat across the aisle and one row behind the driver, a man I hadn't seen before. A new bus driver, I decided. Where do you want to get off, he asked. The Divinity School, I told him. I live nearby. When he turned to listen, I saw that his chin, lower lip, and the entire front of his neck had been grafted with skin, doubtless to release the contracture of a burn scar. He appeared to be in his late 30s. From where I sat, I could see how easily he turned his head from side to side, raised it, then lowered his chin. An excellent functional result, I thought. Not perfect cosmetically, a ridge here, an area of pallor there, but pretty darn good. And all at once, a mist parted, and it dawned upon me that I was the one who had performed that skin graft, that this bus driver, as a child, had been my patient. And a moment later, I remembered a small boy, naked, lying on an operating table, his chin attached to his chest by a great purple fan of scar tissue. So dense was this scar that the boy could not extend his head to see, but must wrinkle his forehead and peer from the very top of his vision. The mouth was pulled open and twisted, the lower lip entirely lost in the wild mass of flesh. I remember leaning over him, holding his hand. I remember his struggle not to cry, until moments later he was asleep. Now, so many years later, I had an impulse to go up behind the bus driver, to examine, to feel, to ask him to show me the donor site. Perhaps I'd recognize it the way one knows his own handwriting. Perhaps he would remember my name. But I stayed in my seat. Divinity, he called out, and I got up to leave the bus. Best not to trespass upon a previous incarnation. And finally, sometimes the patient or next of kin will turn the tables on you. And when that happens, they go straight for your soul. I remember one old man baying in the bed. Every breath was a bone he tried to dislodge from his throat. Oh, such suffering, it was worthy of Job. This man, I thought, will surely die out of debt. But the old man would not die. He wasn't ready yet. Each day and many times a day he had to be changed and bathed and wiped clean, fed, injected, his wounds dressed. His wife was small, frail, and old. I'm taking him home, she